Ladies and gentlemen, journalists and distinguished guests, my name is Dan Sloan. I'm a member of our board of directors. It's my honor today to introduce our guest speaker, Mr. Andre Calantzopoulos, who is CEO of Philip Morris International. This is our second to final, I guess you would say, penultimate press conference here at the current premises of the Foreign Correspondents Club. And it's great that we have a speaker of such renown. He leads the world's largest publicly traded cigarette manufacturer, but both he and PMI are preparing for a smokeless world with words that few of his predecessors would or could have uttered. Our guest says the company's vision is for a smoke-free future, one without cigarettes, and their ambition is to convince all adult smokers who might otherwise continue smoking cigarettes to switch to smoke-free products. On Tuesday, he announced plans to cut the price of the IQOS, I hope I'm pronouncing it correct, is it IQOS? Or?
IQOS.
IQOS. Heat not burn products. It's a tough Japanese market with Japan Tobacco and British American Tobacco also here. But Japan is home to 85% of the HNB market, estimates of its size at about $6.3 billion. I don't want to preempt his speech, so first just a brief bit of background on our guest, who hails from Greece and currently resides in Switzerland. He was named CEO in May 2013 after a 5-year term as PMI's Chief Operating Officer. Much of his earlier PMI career was based in Central Europe, while his educational background was in electrical engineering in Switzerland, and then earning an MBA from INSEAD in France. His first job was in the automobile industry, we share that, where technology, emerging and mature markets, and the regulatory environment have been crucial to product advancement and sustained profitability. Similarly, technology, emerging and mature markets, and the regulatory environment are crucial to the tobacco industry's future. While Japan remains a cornerstone with its still sizable smoking population, it's often seen as a case study for market expansion, and we should note PMI is waiting for FDA approval to sell IQOS in the United States. Our guest reportedly does not like to use the word smoke, so I will say smokeless is okay. But with no further ado, our guest speaker, Mr. Andre Calantzopoulos.
Thank you. First of all, good afternoon to all of you, and thank you very much for giving me the opportunity to speak in front of this very prestigious Foreign Correspondents Club. Before I start, just a correction to Dan's point. Please. We did not cut the price of the products. We offered the second line at the more affordable mainstream price, so to open up the category also to people that have lower ability from a budget perspective. And you know, to Dan's point, you may be surprised to hear that the CEO of a leading international tobacco company say that we in Philip Morris are extremely focused on quitting the cigarette business over time, obviously, but the sooner the better. I've seen a lot of change in the industry over the more than 30 years that I have worked for PMI, but nothing like what we are focused in now. We have a transformative vision, one that can change society. We are focused on creating a smoke-free future, a future that does not include cigarettes. And we want to get there, as I said, as quickly as possible. Our ambition is to convince all adult smokers who might otherwise continue smoking cigarettes to switch to smoke-free products, which are a much better alternative for them, and I will explain. Yes, in an ideal world, all smokers should quit tobacco and nicotine consumption completely. And I think anybody, and we fully agree with this. This is the lowest risk scenario compared with cigarette smoking. But we don't live in a world where this can or will happen automatically or anytime soon. We know smoking tobacco causes disease. We also know that tobacco and nicotine are not risk-free, but they are not the primary cause of smoking-related non-communicable diseases. In fact, the primary cause is the act of burning tobacco and inhaling the smoke, in the same way that it is burning oil and not the oil per se that creates an impact in the environment. Science, engineering, and innovation have allowed the development of a new category of products that don't involve combustion or smoke. Their aerosol contains a small fraction of the toxicants that appear in the cigarettes. And you may know these alternatives as e-cigarettes, and for all of you in Japan, as heated tobacco products. In PMI, we've spent years developing and scientifically assessing the risk reduction potential of these products compared with cigarette smoking. Our scientific assessment program is based on long-standing practices of the pharmaceutical industry and is in line with the US Food and Drug Administration guidance. Every single preclinical and clinical study we have conducted confirms the potential for smoke-free products like IQOS to have a significant positive impact on public health. In fact, IQOS produces an aerosol that contains, on average, 90% lower levels of harmful chemicals if you compare it to the cigarette smoke. It is less likely to cause harm compared to continuous smoking, and IQOS does not negatively impact indoor air quality. There is a growing body of independent studies, including from government laboratories, that points toward the same conclusions. We do recognize that there will be skeptics, and as in the UK this week, those who point to the past and express doubts about the sincerity in our science. I cannot change the past. My focus is of changing the future. Can you imagine the criticism I would face if years from now it was discovered that we had better products for the consumers, but we left them in a laboratory and continued happily selling them cigarettes? In addition to the independent studies, there is growing recognition in several countries, like the UK and the United States, that innovative smoke-free alternatives to cigarettes are likely to be less harmful than continued smoking. These countries view them as an important tool to complement public health policies. To be clear, I'm not saying that smoke-free products are risk-free. I'm saying that switching to scientifically substantiated alternatives is a better choice than continuing to smoke. Many smokers around the world recognize that these innovations work for them. Adoption rates point to a promising future. Well, in the 4 years since we launched IQOS, almost 6 million adult smokers in 43 markets around the world have already stopped smoking and switched. In fact, on average, 70 to 80% of IQOS users quit smoking cigarettes completely and use IQOS exclusively. Here in Japan, the country has seen a 20% reduction in cigarette consumption in the last 3 years since the introduction of smoke-free products. And we believe South Korea and Greece may be able to follow Japan's positive example soon. If IQOS and other smoke-free products are not available to the people who smoke, what is their alternative? They have none. They continue smoking. We hope that they will quit, but in reality, many don't. This is reality. Even with increasing prevention and cessation efforts, today there are more than 1 billion people who smoke cigarettes in the world. And according to the World Health Organization, there still will be 1 billion people who choose to smoke in 2025. These people are your readers, your viewers, your friends and family. This reality must be met with an ambitious effort to offer these men and women help by making less harmful products available, allowing them to make better and informed choices. Those who are suspicious of our intentions have not committed to understanding the science and the real public health opportunity we are working to achieve. As we drive toward a future that is smoke-free, these detractors have become disablers of public health solutions. They are sometimes blocking change, and many smokers are being denied these alternatives. What is more important, helping the people who smoke or hating us? Frankly, I don't think it's reasonable to essentially condemn a population to only smoke cigarettes where there are better products available. Getting the word out is difficult without widespread support and awareness. And innovative products and solutions do nothing if people don't know about them. We are ready and willing to talk with people across all sectors and of all points of view, including those who disagree with us. Look at how other issues of global scale are addressed. Issues such as climate change, gender equality, obesity, hunger, education. A common factor for those issues is recognition that we must work together to try to solve them. Partnerships and coalitions are formed. Energy companies are invited into the conversation about climate change solutions. Major food corporations are allowed a seat at the table for talks about solutions to both hunger and obesity. If we as a world want to meet the goal of a smoke-free future, we as a major tobacco company must be enabled to partner with public and private citizens, regulators, public health experts, and NGOs, and all those who care about smokers, to create movements and inspire change, to make smoke-free products accessible. We remain committed to a smoke-free future and to getting there as quickly as possible. We must continue to move forward to help the more than 1 billion people. We have a duty to help create a better world for these people and for the people who care about them. This is why we are dedicated to rigorous science and innovation that can lead to such better future. This is why we must continue to call for an open dialogue and willingness to consider smoke-free alternatives. And this is why we're here with you today, to share with you what we at PMI are doing to transform not only our business and our industry, but to lead what we believe we can be, one of the biggest public health revolutions in recent history. Before I turn this over to you for questions, let me leave you with one final thought. We're often asked, when will you stop selling cigarettes? Perhaps this is the wrong question. Instead, we should ask, when will people start buying cigarettes? Perhaps, today the consumer demand for cigarettes remains. That's why we have created IQOS, an entire portfolio of smoke-free products, to convince those who would otherwise continue to smoke to switch to satisfying, better products. With the support of governments, regulators, public health officials, NGOs, and private citizens like you, we must create space for these products so that we can more quickly answer not just one, but both of these pressing questions. Thank you again for your time and invitation today. Now please let me know what questions I can answer for you.
Thank you very much. So at this moment, we'll open the floor up to our working press, first of all. As always, please identify yourself and your affiliation. Try to limit yourself to one question if possible, and as always, no speeches. Our first questioner, Tim? There is on this side.
Oh, you have to stand up?
Yeah, it's a little ornate.
Tim Horniak, freelance here at the FCCJ. Just wondering what your response would be to a Reuters article covering a study done recently, the University of California, I'm sure you're familiar with this, that found that the heat-not-burn cigarettes still damage lungs. And the researchers in the study analyzed data submitted by PMI itself to the US FDA in trying to win regulatory approval for the IQOS product. And I'll just read quickly from this paragraph. It says, when smokers switched from traditional cigarettes to heat-not-burn devices, researchers didn't find any evidence of improvements in lung function or reductions in inflammation that can signal tobacco-related blood vessel damage. Just wondering what your reaction to this is.
Very good. I will answer first more generally, and after that specifically. More generally, what we've seen since the advent of electronic cigarettes and now the heated tobacco products is, I wouldn't say purposeful, but an effort to demonstrate that these products are as harmful as cigarettes. And many of the studies, when you really read them, and there are plenty of studies from the University of California and other places, you have always a very, I wouldn't call it inflammatory necessarily, but very strong headline. And when you read through, it is not much, and actually sometimes misleading. And there is absolutely no problem that there is scientific discussion and debate between scientists. That's welcome and open to everyone. However, when this is done on purpose to confuse the people who smoke, with the end result that today in the United States or the United Kingdom, 50% of smokers roughly believe that electronic cigarettes are equally bad or worse than cigarettes. This is irresponsible, because they are not, and everybody knows that. And actually, Public Health England had recently noticed that this kind of studies with strong confirmatory bias or very inflammatory articles in the papers should be cautioned, because they really confuse people. Now, the study you referred to is some of the study results. There was 3-month studies that do indicate change, but they are not sufficiently long in order to indicate statistically significant change. They were all corrected by the 6-month studies we submitted to the FDA, and the FDA was aware of that. And by the way, you see the same deltas in the metabolites mentioned by the study, if I'm not mistaken, that you see in cessation, because some of these parameters don't change immediately after you switch to, say, IQOS or quit smoking. So we've seen a lot of cherry picking from certain institutions, and the thing is, our scientific group is replying to all these studies and publishing their response, but it takes a lot of time and effort, and obviously doesn't make the headlines, the reply. But again, that's what I'm cautioning, but obviously, as anything in science, there will be discussion and debate. It's just to protect the people so they don't get confused.
All right. Our next question, please. Yeah, Art.
Martin Kölling, Handelsblatt from Germany. One question, basically 2 questions, but related. These heat-not-burn cigarettes, how do they compare health-wise with this vape stuff? This is my first question. And what does it mean for nicotine consumption as a whole, switching to these products? Do people smoke more? Do people smoke less? What happens to the smokers and to their behavior?
Okay. On the first question, I can only answer about our electronic cigarettes, because there is such a variety of electronic cigarettes that I don't have the data for all. But I would say if IQOS as a product reduces, if we take major carcinogens and other toxicants, 90% compared to cigarettes. Okay. If you look at the electronic cigarettes, you can have a reduction of up to 95, 98%. Okay. That's why none of these products can be qualified as risk-free. and at the same time they contain nicotine, so there is an addiction element in them. Now, all the studies that are done to date are preclinical and clinical studies that can include ours in particular, because we're the only company that has a full set of preclinical and clinical, like when you approve a drug. Point to risk reduction, but you cannot quantify by disease how much the reduction is going to be. For that, you need epidemiology in the real world. So in 5 years from now, you can start having results on cardiovascular disease, and then obviously respiratory disease and cancers take more time. And we can also do investigator-driven studies on certain groups of people to see if there is reversal of conditions. And we're doing something like this in Japan, for example. So the precise number is going to be available, and it can be, what we should not be confusing is 90% reduction in exposure may lead to 90% reduction in risk. It can be slightly different, it can be 0, it can be 80%, but it is substantial under all circumstances. And in the continuum of products we have, for example, we need always to compromise two things. The ability of the product to switch people, because smokers will try the product. If they have no satisfaction in the taste, if they have no satisfaction in nicotine, if it's very complex for them, they are reluctant to switch. IQOS is the product that has, because it hits tobacco, it's the closest possible you can get, given the substantial reduction to the taste of cigarette. It's never going to be like a cigarette in taste. It has the same nicotine level, more or less, but in taste you can't, because you eliminate by not burning the very toxicants, and many of them have taste. And so it's not going to be the same. Now, as to the consumption, today we have 5 million people in Japan that use IQOS, so we can say the average consumption is the same as in cigarettes, and in the other countries is the same. Because we should not also forget that people pay money for this product, so they have budget limitations as well.
All right, next question, please. Sir, I'm going to follow up on the regulatory side, if I may. Mm-hmm. You're obviously awaiting the FDA, and I don't know if they give you a timetable or there are certain elements to that. But specifically looking at the Japan approval process, mm-hmm. There were other players in the market as well, Japan Tobacco. Did that, was that in any way an easier entrance or easier to introduce your product than the US or other markets?
Well, first of all, a bit more generally. This category of products has not yet been regulated in the vast majority of the countries specifically. And that's what we're advocating. Because to provide clarity to the consumers first, but also to the manufacturers, you need a regulatory regime of what you have to do before you put these products in the markets, after you put them, because you need surveillance, and I'll come to this. And also, what type of differentiation you have in using the risk continuum as a base. If you assume cigarettes are 100% of the risk of disease and premature death, then products that are lower in the continuum must have different regulation and potentially taxation. It's like in any category. And then what type of communication you give to consumers, because we should not forget we're in Japan, there is some ability to talk to people. In countries like Australia or Canada, you cannot display any product that contains tobacco, and nicotine products are even prohibited. You cannot explain to people, so how you want the people to understand. Okay, so we need some adaptations there. Now, the FDA is the only agency that has a full regime. And it's a regulatory regime that is similar to approval of new medicines, of new drugs, that is an ex-ante regime. It's reviewed and approved first, and then in the market. Japan applied in these products by de facto an ex-post regime, which is manufacturers make the product available, but if they make misleading and false statements, then they're liable. Okay, and obviously now we are in discussions, hopefully with the government, and we have some representatives from PM Japan here that know the issue better, to adapt the regulation slowly but surely to this new category. And that should be the general principle, okay? Now, FDA, we're waiting for the review, is still ongoing, because we submitted the latest studies on the modified risk tobacco application essentially in July, so they need some time to review. But my hope is that there will be more of regulatory regimes in the various countries. And, you know, it is the same thing like in any other product. If we want consumers to change behavior, first they need to understand what the problem is. In cigarettes, it's fairly known. Then, secondly, they need to have alternatives. And thirdly, they need to have incentives and appropriate regulation for comprehension. If we take oil, people understand that burning coal is the worst form. You have solar panels, they're not zero impact on the environment, but they're better. And then we explain people they exist, and we give them incentives to switch to them. And I don't understand, and I can go obviously on similar logic in 100 categories of products. I don't understand why, when it comes to cigarettes, that logic is kind of challenged in many places. That defies my own understanding. And so that's where we are.
All right. Next question, please. Yes, sir.
Hello, Oliver Matthew from CLSA. I have a question for you about Japan and Korea. These seem to be the most successful markets. Why is that? And what similarities and differences do you see? And then I notice in Korea, the competitor is making a similar product to IQOS that can be used in your machine. So effectively, you've become a platform in Korea. You're talking about changing consumer behavior. You've invested a lot of money in this platform. To speed up the process, are you willing to open up your platform to other makers? So in a way, an IQOS becomes like a filter, and then you have a different type of brands that could be used on top of your technology. Thank you.
Well, let me ask you on the last first. I think what all of us here, and more importantly, the people who consume the products have to understand is all the science and evaluation process is done on the system. So I can only guarantee the toxicology and eventually the health effects and epidemiology to people if they use the system as intended. When we start mixing devices and consumable parts, then I'm not saying we will come close to cigarettes, don't misunderstand me, that's not possible. But definitely this is not the same product. In other words, there's not the same aerosol people inhale, which is the end product. Now, in general, we are open to discuss, sharing technology, and there are 1,000 economic forms you can do it. But I think it's premature in the category today to have this kind of approaches. And clearly, there are already some infringements to our IP, to our intellectual property, which we are going to pursue. I mean, we see some of these products, you are right, popping up left and right, and some by places and suppliers that I don't even know where they make them how. So we use all our legal abilities to stop this kind of situations. But I think also from the consumer side, information is important. And we saw recently some of this also appearing in Japan. And I think it's our also job and duty to inform people that they should use the system, okay? I mean, just 15 minutes ago was one of your colleagues that had one product from China like this, and I explained to him the logic I just explained to you. And it was also because we had supply shortages clearly with IQOS for a period of time, so people try to find solutions.
Next question. Yes, sir.
Associate member, okay.
That's okay. You'll have to come up front.
Sorry, did you not answer to the first question?
I'm sorry?
Did you not answer to the first
I'm sorry, yeah, Japan, I
thank
forgot.
you.
Japan and Korea, yeah, I'm really sorry. I think when we look at the world today, and we're in 43 countries, mind you, not nationally in all the countries, so it means in certain cities, but not in the entire country. The speed of adoption or switching is governed by a number of factors. I think the most important is the cultural characteristics of people. We know that, you know, Japanese or Koreans are much more innovative and open to innovation than certain European countries, where traditionally any category takes much more time to enter. And also the various degrees of ability you have to talk to people. Because there are different restrictions in different places, and in certain European countries, you cannot even communicate that it is less risky than cigarettes. So we are working on regulation, but we have to admit that in different countries with different speeds. The good news is IQOS is growing in every market we are in. We are also, you know, when we started this venture, I can't say the product surrounding ecosystem was very well done. Because with these products, you need websites, you need after-sale care, you need to handhold the consumers for a period of time to make sure that the first 2-3 weeks they don't go back to cigarettes, because if they do dual, they can fall back. So we had to optimize them, and we're improving every day. So all this together, and we have no digital infrastructure to handle the demand in some places. It was very Salesforce driven, which is not scalable. So I think Japan will remain at the forefront. It's the largest market in the world for this product, has the largest consumer base of IQOS and other competitive product users. As I said, it's 20%, which is amazing. But also from a public health perspective, I'm sure the years to come in epidemiology will prove that that was one of the most important improvements that ever happened. There is no regulation or restrictive regime that has achieved this by any fraction in any given such a short period of time. So that's the bottom line. And, you know, I wouldn't be surprised that in 2-3 years, Japan has a majority of people that, or a minority of people who smoke. And that's the ambition we should all have.
Yes, sir.
My name is Kurt Sieber. I'm an associate member. Thank you for the speech. It's most interesting, and also for these key facts, which I will study with great interest. My first impression is that we can get rid of the 15,000 people in Japan who die due to passive smoking. That, I think, is going to be a very important improvement. Mm-hmm. But my question is about nicotine. You've certainly read the article about your interviews in the Japan Times this morning. And
not yet, but...
Not yet? Well, you should. And the first point which I would like to raise is you are doing quite some clinical trials. And could you elaborate a little bit about clinical trials in connection with nicotine consumption? Also, in connection with nicotine, the article, and perhaps this is not what you actually said, but the article says on one side the people get a nicotine sniff, they call it. On the other side, it also says that the Japanese government hasn't approved the use of liquids of nicotine. So,
yeah.
Can you clarify that for us? Thank you.
Okay, let me answer the last first. If I'm not mistaken, Dan, in Japan, an electronic cigarette, so an e-liquid product that contains nicotine, can only be approved as a pharmaceutical device. You have to go through the pharmaceutical approval route. So none of them has been approved. They are not technically prohibited, but de facto none of them exists in the market. And now, I guess what I said is that when you use IQOS, you get taste that is close to cigarettes, but the nicotine profile is very similar to cigarettes, because that's an important factor. One of the problems we faced with electronic cigarettes everywhere in the world is because the nicotine delivery, if I want to be technical, the pharmacokinetics and pharmacodynamics, how quickly and what amplitude the nicotine has when you inhale the aerosol, it was very weak. People went back to cigarettes. The absence of taste and the absence of nicotine delivery, and I'm talking about the initial stages of these products. Now, these products have improved and will continue improving the electronic cigarettes. So their nicotine profiles are closer. They are not the same as cigarettes. So you need to deliver this to people who smoke in order to switch. Otherwise, they don't. Okay. Now, the only studies we've done on nicotine is the pharmacokinetic profile of IQOS, and we submitted to the FDA, where you see if cigarettes, I don't have the graph here, when you inhale a cigarette aerosol, after 5 minutes, you have 4.5, you have the maximum of nicotine, and then it goes down. IQOS simulates a follow curve, slightly lower, and so on. If you take a nicotine patch, you have a curve like this. That's why it's very ineffective for the smokers. So I think the FDA themselves recently said nicotine is addictive, but is the least problem from a health perspective in cigarettes. Okay. I think there will be discussion and more research about nicotine health effects in the years to come, and we will have probably to do some, because I think the last time I was not even in Philip Morris where the research was stopped for obvious reasons of the past. There are some, studies, but not a lot about addiction, very little about other positive or negative health effects. There are some, in literature, some positive correlations of nicotine with some diseases, like, ulcerative colitis, for example. When people stop smoking, the disease develops, but the mechanisms are not well understood, and some other negative correlations. But today the problem is essentially to convince people to move out of cigarettes, because nicotine or no nicotine, all the things that go with the nicotine delivered in the cigarettes because of the combustion is the worst you can have. Then we can start the research and the debate about nicotine, and when we are in products that are very low risk and only nicotine, obviously that debate will happen. What is the role of nicotine in the future?
Next question, please. Yes, sir. Martin.
We are talking already about other markets. What are your prospects in Europe, especially Germany, basically? What are the barriers of entry, and what are you doing to basically overcome these barriers, and what are your expectations when you will overcome them?
Well, IQOS is available in Germany essentially in 5 cities. Okay. It is in Berlin, in Frankfurt, in Munich, and so on. So Actually, you know, you are German, or if I may ask?
Yes.
Okay. You know, I live in Switzerland. Always, these two countries are not the fastest in adopting new things, but the adoption is always steadier and more persistent, if I may say. So we're making very good progress in Germany. Honestly, not as fast as I would have hoped, despite enormous commercial efforts. With also, you know, the fact that in Germany, we have the BVR that evaluated IQOS and found similar results to ours in preclinical, to be precise, not yet in clinical, but that's very encouraging for us. And as you know, the German consumers may be a bit more conservative, but at the same time, they're very precise. They want to know a lot about the technical characteristics of the product, to the opposite of others. But of course, Germany is very important. I think we are reaching now, like in any category, I would say, until you get 3–4% of people in any given geography or city using the product, you have the first ones that are a bit, don't want to be necessarily always the pioneers. They are the pioneers, but the others want to feel a bit more popularity about the product to enter. At this kind of levels, you see an acceleration in every market. Okay, in Japan it happened, in Korea it happened, in everything. So in some cities now we are about to reach that point, so I'm hopeful that next year we will see much more in Germany and in Switzerland, which to me are the two slowest countries with reasonable ability to talk to people, to be frank, that are behind the curve compared to, you know, Greece, Italy, and all the others. But we are in Germany.
Another question. Yes, sir.
Thank you for the opportunity for a follow-up. I'm intrigued how the nicotine is the same, because when I look at the product, like a cigarette is like this much tobacco type stuff, and then heat not burn, it's much, much smaller. So I was wondering, could you explain that? And then on the same point, so as a company, you've come up with a much better product, which sells at similar price, but with a much smaller amount of, is it tobacco, I think, which is the main cost of your product. So when you scale this product, it looks like it will be phenomenally profitable compared to before. Obviously, you have some technical costs up front. Is that roughly true? And then what would you do with all that extra cash that longer term you'll generate? Thank you.
If you look at the cigarette, essentially half of the cigarette is burned, but it also serves as the energy source that hits the rest of the tobacco to extract nicotine and the aromas. That's why you have so much smoke in the air. If you replace the heating mechanism by electronics, you don't need all this tobacco. Because that's essentially 50% of the cigarette is used as a cigarette, as an energy source. So now this tobacco is much more compact, and you need higher grades of tobacco because you need to extract really taste at lower temperatures. Having said that, you know, I wish that the whole cost of a cigarette or of IQOS were the tobacco. You know, even if you look at the cost of tobacco today, it's 30%, 40% of the product cost, of the absolute basic product cost. Okay. Now in IQOS, we will get one day to variable costs, you know, soon with scale that are similar to cigarettes. It will be higher. Okay. So I think over time, as these new products evolve, the problem is not in my view, our profitability. The problem is what happens to the farming communities that grow tobacco. Because if we use less tobacco, and we have programs already and studies in place on how we do crop replacement for the farmers. It's not an imminent problem today, but it will become as these products become more successful. The issue we have is that tobacco is one of the very rare crops that are not traded in the stock markets. So they're very stable and predictable for the farmer with very good margins. And farmers are very reluctant to switch to other crops until you find, at least for a period of time, a market for them. Because we guarantee, more or less, directly or indirectly, we buy the crop. So that's what we're working on. I think it's feasible, and we're aware, so we're preparing for that. Now, overall, to answer your question about the profitability, yes, we have upfront investments and R&D and commercial costs that are much higher per new. To switch a consumer worldwide, you can spend between $200, $300 and $1,000, for example, or more in Germany, okay, or in Switzerland. But that's the initial phase, okay? Obviously, once you have the word of mouth, you have more. The big difference is also in the fiscal treatment. Today, and I think I said it, governments have recognized that these products are not cigarettes, and either have created, which is the right thing to do, a new category for these products, or in an in-between solution, which is to tax them as other tobacco products that typically are having sometimes more favorable tax regimes. Okay, and for us, if we want everybody to have access to the products, especially people in developing countries, we need to also, pass this tax advantage to the consumers over time. And that's what we'll do. And this is what I opened my discussion we did in Japan. We started with a premium product, which I think is important when you open a new category. I think one of the mistakes happened in the electronic cigarettes industry is because there was no brand differentiation and because there was no technology differentiation, everybody offered cheap products. A consumer bought them because they were cheap. Then they didn't get satisfaction, and then the whole category disappeared. I think it's the right thing to do, but over time, when the size of the consumer base comes close to the limit of the premium segment, then you have to go to the other segments. That's the intention. And for the developing markets, we look both at device solutions that are cheaper without compromising, obviously, the ability of the product to reduce risk, but also other business models, because many of these markets are not pack sales markets. People go to the retailer, like in the Philippines and so on, and buy, 2-3 sticks at a time, and then 5 hours later, 6 hours later, they go and buy 2. How you do this? You have to move the entire thing to the retailer and the consumption to the retailer. So work on a different, and some countries don't have electricity for all these electronic devices. So we have collaboration with some startups that offer these solutions that can benefit, obviously, the population more at large with solar panels and so on, but also attach the product and the fridge, because they need these things for, for medicines and other things. If you go to Africa, electricity is not widely available.
Sir, I'm just going to follow up on that. Looking specifically at Japan, considered a mature market, but obviously with new products and kind of in some places, Tokyo, for example, a tougher regulatory approach to public smoking. What are your R&D or marketing people telling you about the horizon for the Japanese market? What is it going to be like in 5 to 10 years, and how are you going? Who will be your consumer then?
Well, first of all, I think, as I said, we're at 20% people who quit cigarettes and moved to the new smoke-free products. Okay, almost 16% is IQOS, but there are other manufacturers that have products on the market, which is a good thing, because the more variety you have and the more effort all the manufacturers put, the faster we can advance people in the new world. Now, if I'm not mistaken, Dan, there is differentiation already in the regulation about smoking restrictions, with more, the two categories are differentiated, correctly? And look, I think at the end of the day, we will have differentiated regulation, and regulation can help. Any government can apply supply and demand measures to any new product category. Demand measures range from something influencing the pricing, the communication, as we have discussed in this room, the different health warnings, because you need to put health warnings, but they cannot be the same as cigarettes. These products are not cigarettes. And then the importance of the post-market. What I described here is post-market, once you have the product on the market. Research should address, or research at least, 3 areas of, I would say, concern of us and people in public health. Is the advent of this new category of products that has a positive impact, let's assume, on the health of the people who smoke, induce a higher number of people who start now using these products, i.e. nicotine? People who quit in the past, will they relapse and start using these products? And people who would otherwise quit, is the rates lowering? And that you need to survey to see if there is any unintended deviation. Now, nobody has defined what the expected standard is, but the first standard is to define the right ways to do the research. Coming back to the initial question, there is one thing to do, as we see in the US, research when you go to a corner and ask 10 people in their opinion, another on a cohort of 10,000 people. Okay? And with one of the requests we had to the FDA and every government is, can we define the protocols of how you do teenage research, how you do the epidemiological research, so that we all read from the same book and react to the same numbers. But that's important regulatory measures, okay? Now I can go on and on, but I don't want to bother you. And the only thing I would say is, one day, if we incentivize people, manufacturers with the right products and commercial effort, and governments with the right regulation to switch, one day the question is, when is the day that we can start phasing out cigarettes? Through supply-side measures. I mean, you all know, cap and trade. The FDA talked about reducing nicotine to non-addictive levels in the United States, which means essentially forcing people out of cigarettes. All of that can be envisaged. At the moment, we have sufficient penetration or adoption of these products and sufficient awareness. I would say you have to have widespread awareness of new products and at least 50–60% of the market in these products. And then you go to these other measures. Otherwise, you just create contraband. But that all requires, as I said in my address, conversation and adult conversation.
All right. Tim, our last question today.
Your company produces more than 800 billion cigarettes a year, which is staggering. You have a manifesto, it's been called on your website, that the title is "How Long Will PMI Be in the Cigarette Business?" But it does not seem to indicate how long it will be in the business. So my question is, you talk about the smoke-free future, but when will your company stop making cigarettes?
To answer your question, I don't have extraterrestrial powers to give that answer. I think for me, the sooner as possible. We do, you know, stopping selling cigarettes means there is no demand, or the amount of demand of today on cigarettes. Because if I stop selling cigarettes today, somebody else is going to sell them. I don't think I do myself any favor or do consumers any favor. Now, the question is, how quickly can we convince people? People who smoke have free will. How quickly can we convince people not to drink wine? Who can answer that question? How quickly can we convince people without regulatory intervention to drive combustion cars? I cannot answer that question. All I'm saying is, for us, we put the products, we put the R&D, we put the science, and put the money and the people behind. And today, this year, probably 40% of our worldwide commercial expenses will be behind IQOS, although it represents today a growing, but 6% still of our total volume. And that number, if applied to the 40 only countries we are in, you will see that it is the vast majority, if not the totality of the money we invest, is in IQOS. I don't think Japan has left much money in the combustible business, despite the fact that they're very sizable and profitable. They're all on IQOS. So we put our money where our mouth is and our resources. But I don't have the divine power to convince people tomorrow to move. And then the regulators have also to do their bit. I mean, when we see Hong Kong going in the other direction and say, I prohibit this, what alternative do they leave to the people in the country? Essentially to continue smoking. No, I don't know if that's reasonable or not. But at least, can we look at facts and have a reasonable approach to the problem, which I think other countries are taking. The US is taking it, the UK is taking it. Even New Zealand, that was essentially for banning of these products, is changing from what I understand opinion. So I think over time this movement will start with governments, and that is an enormous help, because if the government of country X tells their citizens, you should not use nicotine products, which by the way we should start educating kids and stop saying don't smoke only, because if in the US some of the kids may say, well, I don't smoke, I use X, Y, Z product. So you should not use nicotine, but if you use nicotine, can you please not use the worst form of delivering it and use another one? And that can almost help. The public health system can help. If you get positive enforcement to the people who smoke, from one side, from the other side, from their friend's side, for the people who experience the product, finally they will move. But it's not a simple task, believe me. So to me, I said my objective is by 2025, at least 40% of the volume, assuming of PMI will be in these products, and that will represent the majority of the revenues. But if governments help, that can happen much faster. And if other manufacturers get incentivized and move into the category, that also will happen faster. So, and if public health people stop debating the principle of whether better products should be allowed in cigarettes, as if these consumers were the only people that are different from the rest of the world, then we can move much faster. That's all I'm saying.
All right, well, that will conclude our briefing today. As with all guests at the Foreign Correspondents Club, you are an honorary member of the club for 1 year. We're about to move premises. Next time we see you, we'll be in a swankier neighborhood, a newer club, and we welcome you back at that time.
Thank you, Dan. Thank you very much. And thank you all for bearing with me.
And if you wanted to take a picture, I believe the products are up here as well.